Thorax consists of 12 pair of ribs which anteriorly to the sternum via their costal cartilages and posterior through the thoracic vertebra. To find the sternal angle, place your finger in the hollow curve of the suprasternal notch and slide your finger downward about 5 cm until you feel the bony ridge that joins the manubrium to the body of the sternum. This is the sternal angle. Now move your finger laterally, find the adjacent second rib and costal cartilage. Using two fingers, walk down the interspaces, one species is at a time. Posteriorly, the 12th rib is starting point for the counting the ribs and the interspaces. Find the adjacent 12th rib by pressing your finger on and up from below the rib cage, then walk up the interspaces above. The inferior tip of the scapula is another useful bony landmark. Now, with the patient's neck flexed forward, find the most prominent spinous process, which is usually the cervical 7 vertebra. Then feel and count from the cervical 7 vertebra to thoracic 12 vertebra. To begin with the examination of the chest and the lungs, note the shape of the chest and how it moves. Is it symmetrical or there is any bone deformities? Observe the rate, rhythm, depth and effort of breathing and listen to any audible sound of breathing that may indicate respiratory distress. Now listen and count number of breaths per minute. Normally in resting adult breathes easily and regularly about 14 to 20 times a minute. Inspect the patient's neck for retraction of the accessory muscles, name supraclavicular, sternocleidomastoid, scalene muscles, suggesting respiratory difficulty. Normally, this is not present. Palpate the sternal notch to check the position of the trachea and it should be in the midline. Now check the patient's color for nail bed cyanosis. A blue color arises from the deoxygenation. Lips, finger and nails are normally in pink. Examination of posterior thorax. Observe the chest for symmetry and deformity. Inspect the overlying skin. Palpate the chest wall to locate any areas of pain. To test chest expansion, place your thumb close to the patient's spine at the level of 10th rib and spread your fingers lightly across the lateral thorax. Ask the patient to inhale or exhale deeply. While you watch the divergence of your thumb normally about 2 cm and feel the range and symmetry of the movement. Next, symmetrically palpate for tactile phragmitis. Feel the vibration of tactile phragmitis as the patient continues repeating 99. Using your hand, identify the areas of increase, decrease or absent phragmitis. Continue the examination of the chest in systematic manner, moving down the thorax and going from side to side. Demonstrate in ladder pattern that only the distal interphalangeal joint and your finger should be in contact with the chest wall and note the sense of vibrations.